Hello everyone, now let us discuss about anatomy of musculoskeletal system, pectoral girdle. Now, pectoral girdle is also called as shoulder girdle. The human body has two pectoral or shoulder girdles that attach the bones of upper limbs to the axial skeleton. The function of pectoral girdle is to attach the bones of upper limbs to the axial skeleton, and there are two shoulder or pectoral girdles in the human body. Each of the two pectoral girdles, they consist of two bones, clavicle and scapula. And one more important point is the pectoral girdles do not articulate with the vertebral column, and they are held in position and are stabilized with a group of large muscles that extend from the vertebral column and ribs to the scapula. Pectoral girdles, they do not articulate with the vertebral column, that is, they are not joined with the vertebral column. Coming to the two bones of pectoral girdle, the first one is clavicle. Clavicle is slender S-shaped bone which is also called as collarbone. It lies horizontally across the anterior part of the thorax, superior to the first rib. The location of clavicle is anterior part of the thorax, superior to first rib. The next is scapula. Scapula is also called as shoulder blade, whereas clavicle is also called as collarbone. Scapula is also called as shoulder blade. It is a large, triangular, flat bone situated in the superior part of the posterior thorax between the levels of second and seventh ribs. As we know that there are two pectoral girdles in the human body, and each pectoral girdle is composed of two bones, clavicle or collarbone, scapula or shoulder blade. The clavicle, it is an S-shaped slender bone. It is an anterior bone and it articulates with the manubrium. Clavicle articulates with the manubrium of the sternum at the sternoclavicular joint, whereas scapula articulates with clavicle at the acromoclavicular joint. Scapula articulates with the clavicle at the acromoclavicular joint. And this scapula, it articulates with humerus at glenohumeral joint. These are some of the points of articulation. Clavicle articulates with manubrium of the sternum at the sternoclavicular joint, whereas clavicle articulates with scapula at the acromoclavicular joint. And when it comes to scapula, the scapula articulates with humerus at glenohumeral joint. Now let us discuss some of the structural features of clavicle. Clavicle, as we all know, it is a S-shaped slender bone. It is also called as collarbone. It has two ends, acromial end and the sternal end. The sternal end is the medial end, whereas the acromial end is the lateral end. The sternal end is the medial end, rounded and articulates with the manubrium of the sternum to form sternoclavicular joint. The sternal end of the clavicle, it articulates with the manubrium of the sternum to form sternoclavicular joint, whereas the lateral end is a flat acromial end. This is flat. If you can see here, the lateral end is flat acromial end, and it articulates with the acromion of the scapula to form acromioclavicular joint. Acromioclavicular joint. The next important point is the conoid tubercle. Conoid tubercle is the point of attachment for conoid ligament, which attaches clavicle to scapula. This is the point of attachment for conoid ligament which attaches the clavicle to scapula. The next is impression for costoclavicular ligament. As the name indicates, it is the point of attachment for costoclavicular ligament which attaches clavicle to the first rib. These are some of the structural features of clavicle. Now let us discuss the structural features of scapula. It is a triangular bone. It is also called as shoulder blade. And the lateral end of the spine. Each scapula, it contains a projection called as spine, and the lateral end of the spine, it projects as a flattened expanded process called as acromion. The lateral end of the spine, it projects as a flattened expanded process called as acromion, and at the lateral end of the superior border, this is the superior border. At the lateral end of the superior border is a projection of the anterior surface. Projection of the anterior surface called as coracoid process, to which the tendons of muscles and ligaments attach. This is the coracoid process to which the tendons of muscles and ligament attached. Next, inferior to acromion. Inferior to acromion is the glenoid cavity here. This is the glenoid cavity, a shallow depression. This is the shallow depression called as glenoid cavity that accepts the head of the humerus to form glenohumeral joint. Glenoid cavity is the part which accepts the head of the humerus to form glenohumeral or shoulder joint. And the lateral border, it consists of two borders, medial border and the lateral border. The lateral border is also called as axillary border, whereas the medial border is called as vertebral border. This is the subcapsular fossa. This is the scapular notch, and this is the superior angle, and this is the superior border. And this is the lateral end, and this is the medial end. The lateral end is called, lateral border is called as axillary border, whereas the medial border is called as vertebral border. These are some of the structural features of scapula or shoulder blade. Thank you for watching. Please subscribe for further videos on anatomy and physiology.